Actually, we don't use the term method, we use the term in nowadays concept. So I'm going to explain what is PNF concept. So it's a very intense, I would say, a clinical reasoning idea, which use say proprioceptors and exteroceptors, means receptors to the brain, and expecting from the brain reactions, which actually it's links to what I said, clinical reasoning, and also functional goals regarding the patient's needs and expectations. PNF is an active approach. It's not passive. So that means that the patient all the time is involved actively together with a therapist, and he has all the time to follow the instructions and also the guidance of the therapist. And this is what really makes the difference, because patients finally have very good fun with that. PNF is for all physios. Of course, it can be for other specialties. We can use it for occupational therapists, basically. And of course, in some countries, there are also medical doctors, especially rehabilitation doctors, are really interested for this cause. This is the big benefit of the PNF, because with the PNF you can treat big areas of in rehabilitation. So it means orthopedic, you can use it for neurological patients, rheumatological patients, patients after traumas, operations, medical internal medicine, gynecologists, pediatrics, everything can be treated by the PNF. Yeah, actually we use it for basically orthopedics and neurological patients, but as I said before, it can be used in any field. But you can imagine patients after stroke, patients, spinal cord injuries, Parkinson patients, it can be also for MS patients, orthopedic patients, low back pain, after operations, hip arthroplasty, knee arthroplasties, operations, arthroscopies, sports, any. They learn all the facilitations regarding the PNF. Yeah, of course, the famous patterns in different positions. They learn activities and facilitations on mats and task-oriented approach as well. So it's actually it's a very intense course with a lot of practical skills. I think the PNF is the only approach, is the only physiotherapy concept, method, whatever, which can treat the patients indirectly, not all the time directly. So you can consider patients which are in a bad condition, after very fresh, after in an acute stage, after operations, after traumas, can get the benefit from the PNF the most. It's not just me. But of course, the PNF is taught internationally by the members of IPNFA, which all of us, we are teachers, and we have this very intense, I would say, training, and all of us, we are very experienced, first as a therapist and then as a teachers, and that makes the big difference. I would answer a bit differently. I would say, for whom this course is not. So if you treat patients in a passive way, if you like just only dealing with modalities, if you just feel a bit, I would say, not so active, yes, this is not a course for you. So, of course, I'm joking. I'm saying that, okay, if you really like to have an intense course, if you really like to have a good time with the patients, if you really like to stimulate them, and to have fun with them, because remember, PNF means patient need fun. So this is really a very good course for you. If you like to find this course, then you should contact the Privilio, which is a company which organizes already many years now courses in Košice, Slovakia. So you can find us here, and today, of course, we are running a course. So don't miss it.